Hello, my name is Dr. Alan Kerry. Welcome to another podcast from the South Essex GP Training website. With me I have Dr. Sunil Gupta, and we're going to discuss the topic of breaking bad news in general practice. Sunil, what are 7 areas that we should consider when we're going to break bad news to a patient?
The 7 areas to consider are preparing ourselves, preparing the setting, preparing the patient, providing information, providing support, providing a plan, and what to do after the interview.
Can you say a few words about how we should prepare ourselves and how we should prepare the setting?
In terms of preparing ourselves, we should have the facts right first. We should familiarise ourselves with the patient's background, medical history, test results, and possible future management. We should mentally rehearse the interview, including the likely questions and the potential responses. And the relatives can be in attendance, however, we should be guided by the wishes of the patient. In terms of preparing the setting, we should meet in a quiet room, arrange some privacy and ensure that we're not going to be disturbed. And if we've recently examined the patient, we should allow them to dress themselves before the interview.
Okay, and how should we go about preparing the patient?
We should assess the patient's understanding of their condition. What do they know already? What have they been led to expect? While many patients want to have details about their disease and diagnosis, some patients do not want this detail and their wishes should be respected and appropriately managed. We should never impose information and we should build up gradually.
Thank you. So what do the experts advise about how we should provide the information itself?
What the experts say is we should use basic communication skills, use simple language, listen, follow up verbal and non-verbal cues. We should start at the level of comprehension and vocabulary of the patient. We should avoid excessive bluntness, as it is likely to leave the patient isolated and later angry. We should set the tone, a phrase something like, "I'm afraid I have some bad news." The information should be given in small chunks and we should stop periodically to check the patient's understanding. Statements like, "Is this making sense?" or "Would you like me to explain more?" When the prognosis is poor, we should avoid using terms such as "there is nothing we can do for you," as goals in care will change to pain control and symptom relief. We should remember to be truthful, gentle and courteous. We should offer hope. We should emphasise the positive and we should allow questions.
Thank you. What tips are there for providing support and providing a plan?
For providing support, we should acknowledge and identify with the emotion experienced by the patient. When a patient is silent, we should use open questions, ask them how they are feeling or thinking. How are you feeling now? We should not say, "I know how you feel." Empathy can be shown by using terms such as, "I think I understand how you must be feeling." We should allow the patient time to express their emotions and let the patient know that we understand and acknowledge their emotions. And unless the patient's emotions are adequately addressed, it is difficult for the patient and doctor to move on to discuss other important issues. But remember, the patient's crisis is not your crisis. You're there to listen. In terms of providing a plan, we should provide a clear plan for the future with treatment options or management plan discussed. We should identify support systems and involve relatives and friends. We should offer to meet and talk to the family if not present, make written materials available and summarise.
Thank you. And what should we do after we've had that interview with the patients?
So after the interview, we need to make a clear record of the interview, the terms used, the options discussed and the future plan. We need to inform other people who are looking after the patient what we have done. There may need to be a number of meetings and we need to follow up the patient.
Is there anything that we shouldn't do when we're breaking bad news?
We should not break bad news over the phone. We should not avoid the patient. We should not leave the patient in suspense. We should not lie to the patient. We should not tell the patient if he or she does not want to know. We should not interrupt excessively. We should not use jargon. Other things we shouldn't do are giving excessive information, as this causes confusion. We should also avoid colluding or being judgmental. We shouldn't give a definite time span. It's probably better to just say things like days to weeks or months to years. We should not pretend treatment is working if it isn't, and we should not say there's nothing that can be done.
Thank you very much. Sunil and I would like to thank you for listening. We hope you'll listen to some of the other podcasts from the South Essex GP Training website.